Hello, and thanks for listening to the MiCare Champion Cast. Whether you work in healthcare or not, you may be curious about the role artificial intelligence plays in our hospitals and health systems, and what it will look like in the future. In today's episode, we'll learn from two experts about current and future advancements in healthcare AI. More specifically, we'll hear how it's being used in hospitals, address commonly asked questions and concerns, and explore what we can learn from other industries using AI to advance their operations. Joining me virtually, I have Bruce Brandis, president of Care.ai, and Monica Holmes, bioinformatics PhD candidate at Michigan Medicine. For those not familiar, Care.ai is an MHA-endorsed tech company building AI platforms and advanced sensor technology to power more human healthcare. Bruce has more than 30 years of experience in executive management and entrepreneurial thought leadership. He is also a longstanding member of the American College of Healthcare Executives and is currently leading the creation of smart care facilities through the development of ambient intelligence in healthcare. Monica joins us with a background in bioinformatics and is a member of our new MHA AI Task Force. She is also a board member at Trinity Health Chelsea Hospital, where she serves as chair of patient quality and safety and a graduate of our MHA Excellence in Governance Fellowship. Monica and Bruce, welcome to the podcast, and thanks for being here.
Thanks so much for having me.
Yeah, thank you. Thank you to you and the MHA team for hosting me on this podcast. It's an honor to be featured here.
Of course. Well, I know we have a lot to cover today, so we'll just get right into it. I'd love to learn a little bit more about the two of you. So if you don't mind kicking us off with a little bit more about your role and background, and also maybe why you chose the field that you're in. Monica, do you want to kick us off?
Yeah. Hello. And thank you to the MHA team for hosting me. It's an honor to be featured here. I am currently a bioinformatics PhD candidate at the University of Michigan. I am mentored by Dr. Brian Athey, whom is the chair of the Department of Computational Medicine and Bioinformatics at Michigan Medicine. Just a little background, bioinformatics is an interdisciplinary field of science that develops methods and software tools for understanding large and complex biological data sets. My research focus is on the field of pharmacogenomics. I'm currently developing a pharmacogenomic assay utilizing next-generation sequencing technology. My research is funded by Phenomics Health, a biotechnology company focused on personalized medicine. And, I chose this field because by understanding how a person's genetics affects their response to medication, we can improve medication safety and efficacy and lower medical costs.
Wonderful. Thanks for being here. And Bruce, what about you?
Bruce Brandis. I've spent 35 years now in healthcare information technology, long before we called it digital health, and primarily with growth stage software and technology companies that were really at the leading edge of applying technology in transformative ways. I started my career at a business school with IBM, and it just so happens that IBM assigned its new marketing reps to an industry vertical, and I was fortunate to be assigned to the healthcare industry vertical. And I remember vividly as we were getting our onboarding and training, and they were explaining to us how healthcare worked as an industry. And coming out of business school, I just kind of scratched my head and I said, this is completely illogical how hospitals are run and how they get paid. And then I puffed out my chest at 22 and I said, but I work for IBM, technology will fix all this. And I always joke that I've spent my entire career shuffling deck chairs on the Titanic because I feel like too often technology has made caregivers' lives harder, not easier. And obviously that was never the intention. So I'm excited to have this conversation because I do feel like we're finally at a point where technology is becoming invisible and has the opportunity to restore humanity to how healthcare is practiced.
Yeah, that's wonderful. Thanks for being here. And I know a lot of people talk about AI like it's this new and up and coming thing, but it's really been in healthcare for years, and I would probably maybe argue decades, and we just haven't noticed it. So to set the stage, Bruce, maybe you kick us off by sharing what you would say the temperature is from patients and providers in healthcare with AI.
Yeah. I would say it's somewhere in between irrational exuberance on one extreme and apocalyptic fear on the other. And clearly, there's somewhere in the middle that's actually probably more accurate. I think back on so many of the things that are new that we tend to not understand, to try to look and see what is it that we can we can discern as to what this will look like in the future. And the most notable thing that I'll call out is, you're right, AI is not new in healthcare. It's not new technology. And historically, what most AI has been is really math. If you think about it, it's really been more on the computational side of things, and we'll get into some examples of that. The reason AI is getting so much attention just in the past couple of years is because of the advent of generative AI, where it's really more creative writing instead of the math side, if you want to think of it logically that way. And of course, because of that, a lot of the investment, we're getting a lot smarter, and the AI is getting a lot smarter in terms of how it's being applied. But I feel like what I tend to tell most people is, because there's so much noise in the industry right now, and in society in general around AI, but and the fear mongering and the irrational exuberance that go with it. But I think back to how other technologies have evolved, and if you look at where we are with AI, I think we're probably within a year or two of any company that says, oh yeah, we're using AI, or we're an AI company, sounding just as ridiculous to call out as a starting point as it would be if I were to come to you today and say, hey, guess what? We use computers and the internet.
Right. We use Wi-Fi.
Of course you do. The question is, what are you doing with it? What problem are you solving? How is that better or different than the way we do things today? And so I think that's really where most patients and providers are today, which is, hey, forget the noise. Tell me what you're actually doing with it and why it matters to me.
Mm-hmm. Yep, that's exactly right. And just to call out a few more examples, I know you'll get to some later in the episode, but AI is being used for data analysis, disease diagnosis, treatment, radiology, language processing, collecting large amounts of patient data. This is not new. This has been happening, right?
Certainly. And I think the most mature area where we are related to AI in healthcare is if you think about assistance in reviewing X-rays and other scans from a radiological standpoint. It can find things trained properly with input from now hundreds of thousands of the best radiologists in the world. It can help not to make the decision for the radiologist, but it can help to guide the radiologist perhaps to see things that he or she may not otherwise detect in the moment.
Right. Monica, what would you say the temperature is from the Michigan medicine side?
I would say you could kind of break it up into two perspectives. There's kind of the patient perspective and the provider perspective. I would say on the patient side, there's a lot of curiosity, some optimism. Many patients are really curious and optimistic about the potential of AI to improve their outcomes. They do see a promise in AI for faster diagnosis and personalized treatment plans. There is some concerns about privacy. So I think there's a significant concern regarding data privacy and security. So patients do worry about their sensitive health information and how it's being used and protected by these AI systems. And then there's trust and reliability. There's, trust in AI is a major factor right now. I think patients are generally cautious and they want assurance that AI technologies are going to be reliable and they're going to be validated by the professionals through rigorous testing. And I would say on the provider side, they're really excited about improved kind of efficiency and accuracy. So they are looking at the potential in AI to increase their workflows, reduce errors, kind of improve diagnostic accuracy. It's a tool and it can assist providers in analyzing large volumes of data quickly and aiding in some of the decision-making processes, but not, taking over the decision-making process. That's still ultimately the provider's responsibility. I think that they are, looking for, seamless integration and user-friendly interfaces. They don't want it to be, a huge disruption to the workflow. So I think that the challenge right now is, how to integrate AI into existing health systems and not, help take away some of the burden on the providers, not, add additional burden, going through kind of change management processes with their workflows and making sure that that's managed well. And, I think providers are also concerned about, ethical issues, the implications of using AI on their decision-making. And they really are emphasizing the need for maintaining, human oversight and ensuring, AI is a support rather than a replacement to any human judgment. But I would say, overall, like both patients and providers, they recognize the potential benefits of healthcare using AI, but also the need for careful consideration in the areas of, data privacy, system reliability, ethics, and, how to successfully integrate AI into the healthcare practice.
Right. Yep. And we're definitely going to get into some of those questions and concerns later in the episode and how hospitals are navigating those. On the efficiency piece, unironically, yesterday I went to the dentist and I had to get a mouth guard, and I was expecting them to put a mold in my bottom teeth, and they ended up just using a camera and they 3D printed it in like 3 days. So I thought that was incredible. I was like, this must be AI. And that's kind of a very small, personal example of how is helping with efficiency in our healthcare delivery. So I thought that was funny that happened right before we did this.
Yeah.
So Bruce, I know you spend a lot of time helping our hospitals and you are understanding where they can utilize new technology in their practices. Can you talk us through that, where some of the opportunities lie today and then maybe some in the future as well?
Yeah, well, first of all, specifically as it relates to hospitals, let me talk about what are the problems that we're trying to solve with AI, and there are plenty. But I think of two overarching existential threats that we have to our health systems. One is increasingly what we've asked of our bedside caregivers has become humanly impossible. And as I mentioned, sadly, the technology we've brought to bear has made their lives harder, not easier, whether it's the electronic medical record and having to turn your back on a patient to type into a computer, or with the best of intentions, a lot of individual point solutions, which by themselves have utility, but collectively are further fragmenting an already very fragmented caregiver experience. So therefore, we don't have enough caregivers. We won't have enough caregivers. Too many are leaving the profession, and because the job is just really, really hard, physically, emotionally, and mentally. And then the second thing is, even if we had all the labor that we needed, the underlying costs of our current acute and post-acute care models are fiscally unsustainable. And so, the real question is, how do you take a step back instead of just tinkering around the edges and really reimagine, how we do all this? And that's the opportunity that AI represents for us. And then if you look at it from a macro view beyond just the hospital, we're spending $4.5 trillion in the United States every year on healthcare, and 19% of our GDP. And so there has to be a way to bend that cost curve and improve the quality and outcomes. There's got to be a better way. And let me first touch on, at a high level, I think that there are really 4 broader buckets on where AI is being applied effectively today in healthcare. One, we touched on a little bit earlier around diagnosis and treatment. So the ability, for example, to have AI assist in reading scans and to be able to do more comprehensive detection of potential problems and then to treat those problems and diseases. Secondly, we're seeing AI applied at scale in life sciences and clinical research to accelerate clinical trials, get new drug discovery done faster and more accurately in a more targeted way. Thirdly, we see an explosion of consumer empowerment opportunities with all the different wearables and sensors that individuals can wear. In a previous life, when I was at a company called Livongo, we were helping to use these connected devices, apply AI to capture what we called applied health signals, where you could capture somebody who had diabetes and to find the key metrics around their glucose reading and blood pressure and other tracings to be able to help prompt that consumer toward healthier behaviors in the moment. And now I would say for hospitals and health systems, the fourth bucket, the tremendous opportunity is really around clinical and operational workflows and transforming how we deliver care in the inpatient and post-acute, acute and post-acute settings. And to me, that's where we're seeing the most activity right now as it relates to hospitals, is really looking at how do we become, one, more aware of all the data that we might need to capture to truly be more holistically aware of what's happening? And then how do we use AI to drive action in the moment with the most relevant information and the most relevant interventions for our caregivers, where and when they need to take them? And so we can double click on some of the very specific use cases, but those are the broader buckets of where we see AI being applied in healthcare. And then I'll pause and then we can double click on specific use cases.
Yeah, Monica, anything you would add before we have Bruce dive into some of those?
Yeah, I agree. I think there are, numerous opportunities for AI in healthcare. They span various domains. And yeah, I would agree that I think Some of those major buckets are patient care, operational efficiency, and medical research. So, we can dive into, each of those areas and discuss kind of how they would, benefit from using AI. Do you want Bruce to kind of dive in and continue with his, he's laid out the field pretty well. So I'll let him, dive into those areas.
Yeah, Bruce, take us from the top, and then Monica, feel free to jump in whenever.
Sure. When you think about all of the work and tasks that are overburdening our caregivers, specifically around a lot of regulatory and administrative tasks that need to be done that I would contend are likely not the reasons why anyone went to medical school or nursing school. We really do have a great opportunity to look at very simple things like around clinical documentation, instead of having to type into the computer, to use AI and ambient sensors to be able to capture voice, to be able to understand what's happening. If you think about compliance reporting, things like leapfrog hand hygiene compliance, for example, to be able to capture, did somebody wash their hands, and to be able to create those reports instead of having a human being with a clipboard watching 200 people wash their hands every month.
Right.
And then if you think about a lot of the other burdens around, and some of this starts to now bleed into patient safety, but the ability to watch patients, to be aware of if someone is at risk for a fall, to make sure that we're using ambient sensors to watch over them, to essentially using computer vision to be able to detect if they're moving in a way that indicates that they're about to get up, and then layering in AI to intervene, to give them an alert to let them know, please stay where you are, help is on the way, before they risk getting up and falling, or just doing administrative rounds, and to be able to understand whose room do I need to focus on first. And so I'm giving those as a few of the obvious immediate examples of what people are using AI for today. The broader opportunity is to use these same sensors that your virtual nursing is a good example of a first use case where people are putting cameras in the room. The opportunity to think of that camera in the room that's being used for virtual nursing, one, not just for nursing, that it's more broadly applied for all virtual inpatient care and all the other caregivers that can benefit from that. But then secondly, that camera being a smart sensor that becomes ambiently aware of capturing a lot of additional information around what's happening in a room. Did housekeeping come? Has the food been delivered? Was the food eaten? Is this patient at risk for self-harm? How do we detect them? And based on those motions and those people in and out of the room, again, still protecting privacy, which we'll double click on, capturing that data and layering in AI to take all of that additional data and understand what interventions are appropriate in any given moment, so that we can be more proactive and preventative in how we're delivering care.
Right. Yeah. So I just want to emphasize that these tools are helping with healthcare quality and safety, in addition to taking some of the burden off of our clinicians.
I think the administrative burden is the table stakes, and I think that what we really need to think of, and you mentioned this earlier, what's the future? I think the future is starting to really lean into the harder stuff, which are the clinical interventions and things that are really starting to affect how care is actually physically being delivered, not just relieving the administrative burden. That is table stakes. Absolutely, that should be happening. But the question is, how do we go deeper? How do we go more transformative?
Right. Absolutely. Monica, anything you would add before we jump into more of the future technology that's coming?
Sure. So I think the opportunities with AI in healthcare today, they include, as Bruce mentioned, clinical decision support. So as of today, it can help with diagnosis and treatment recommendations. It can help with analyzing medical images, lab results, the patient histories, and then help make recommendations based on best practices and the latest research in the field. And it can also help with, predictive analysis, helping, make predictions on disease progressions and potential complications, and, helping to enable more proactive intervention in care plans. I think the first area that we're really going to see, or that we already are starting to see AI being used clinically, is kind of around the medical imaging and diagnostics. So it can really help enhance the accuracy and speed of interpreting some of these medical images, such as X-rays, MRIs, CT scans. It can really help radiologists in identifying, any abnormalities very quickly. We also see it in pathology. AI-powered tools can assist in pathologists when they're examining, tissue samples or trying to identify cancerous cells. And as Bruce mentioned, there's the patient care and monitoring. AI. There's a lot of AI-driven wearables and home devices that can monitor patients' vital signs in real time and alerting like any healthcare providers to any concerning changes. And then, in personalized medicine field, AI can analyze, genetic information and patient data, and help develop treatments like specifically for that patient's and that patient and their genetics, and help like reduce any potential like side effects to any medications. And then, I think on the operational side, just improving kind of a lot of the administrative workflows. So like scheduling and like resource allocation, AI can be used to optimize scheduling for patients, staff, and that can help with like reducing some of the wait times that we're seeing. And then, on the business side, like supply chain management, helping to streamline inventory management and ensuring like the medical supplies and medications are, available. So kind of reducing, the business supply chain management burden as well, which is all part of the healthcare system.
Right.
So I think, there's like lots of areas that AI can, is being used to improve patient outcomes right now and enhance operational efficiency and reduce cost and, advance medical research, as Bruce mentioned, and drug discovery. So I think that, it's already here, and there's lots of excitement for like future opportunities as well.
Yeah, I appreciate you both walking through so many examples. In both of your roles, I would imagine you're seeing firsthand how this technology is helping patients and providers, and you elaborated on specifically how. But in your work, have you had any moments with either providers or patients that you were like, wow, this is really making a difference?
Yeah, I mean, I'll give one example, and it actually affected both patients and providers. But just being able to put a layer of technology, work with a large academic medical center in Tennessee that implemented virtual inpatient care layered in with ambient support with AI specifically for virtual nursing and virtual sitting, one-to-many patient monitoring. And in the first unit that they went live with, for the first time ever in that organization's history, on their Press Ganey patient satisfaction scores, within 3 months of going live, they hit 100% on likely to recommend hospital and rate hospital for the first time in that hospital's history, 150-year history. Not that they were tracking patient sat back in the 1800s, but. That really was very striking. Now, may or may not really be sustainable, but that just goes to show what the first impression is of having this type of technology as an added measure. And then the same organization, we've seen very significant reduction in turnover of nursing staff. They all now want to work on the units that have this technology because it essentially frees up their time so that they can focus on where they physically need to be at any given moment, which patient needs them most in the moment. And also when they physically can't be there, they know that their patients are being watched over in an appropriate way to keep them safe and to address their needs, even when they physically can't be in two places at once.
Right, exactly. Monica, any examples from Michigan Medicine that you would share?
I would say, at Michigan Medicine and my field, using bioinformatics tool to do big data analysis, it really does help improve, the ability to analyze large amounts of healthcare data and look for like correlations and insights to help drive medical research and public health initiatives. So on the academic side, it's improving, our ability to do research, which leads to better insights and, ultimately better health outcomes for patients when it's translated over to the bedside. And in genomics, so, we use computational tools or AI to analyze genomic data and to identify genetic markers associated with disease. So this helps enable the advancements of precision medicine. So it helps, empower the patient to understand their genetics, and then take that information to their providers, or sometimes the providers, do gather that information or order genetic tests on their own to help guide their decision making and drug prescribing plans. So I think that I've seen personally a lot of patients that have, not been on the right medications, or have been, had to switch medications, or really suffered from a lot of side effects from their medication. And they were able to, get on a better or enhanced dosage or drug to help manage whatever, their specific disease was. And so I really think that, I've seen a lot of improvements in patients with their treatment plans, just by being able to get information about their genomics, which is only really made possible through what is known as AI, or the advances in computational medicine. So it really opens up the door for patients to get more information about themselves, and that helps providers get them on a better medication or a better dosage more quickly.
Right. Yeah, we think about the time it takes just to get in to see a doctor a lot of the times, but then the amount of time it takes to give them the full health history and help them understand, if you're already on a prescription, and then they have to figure out if that's going to interact with a different prescription you need. And the whole diagnosis process is very long. So the fact that is more efficient, or will be and continues to be because of AI in healthcare, I think is really a fantastic thing for patients and providers. Bruce, can you walk us through some of the future opportunities that you see coming?
Well, first of all, I agree with you. Healthcare today is slow, inefficient, and reactive. And if you start to think about the opportunities that Monica was just describing around hyper-personalizing a patient experience, because we know, their genetic makeup, and we understand exactly which specific intervention and which specific medication may be most effective for their physiology. The opportunity for healthcare leveraging AI in a very targeted way, is going to become much more predictive and preventative and proactive. And as a byproduct of that, we're going to be able to drive down costs. We're going to be able to improve health. And so I just echo the comments that Monica made earlier, and then I'll build on that to share. I think the really exciting opportunity for me is, as you start thinking about these things working, is to now look at all of the health disparities we have in terms of access to care, cost of care, and we know those issues. I think that this technology has the opportunity to finally democratize access to quality healthcare everywhere, and eliminate a lot of the temporal, physical, geographical boundaries that have economic boundaries that have historically limited access to high quality healthcare. In the future, if you have access to a smartphone, you should have access to experts at the Cleveland Clinic. You should have immediate access to a primary care doctor, or the appropriate caregiver to diagnose a particular condition. You should have access to sensors and wearables through that connected device that is going to be, if you're at higher risk because of a comorbidity, to be able to preventatively anticipate that the early warning signs indicate that you may need to go in. You mentioned your trip to the dentist. I'll tie it back to that, as well as I just got my oil changed in my car. I take better care of my teeth and my car than I do the rest of my body, and it's because I have a warning light that goes on my dashboard that tells me, hey, you may need to get this checked out. Well, your body doesn't come with those warning lights. You just break down on the side of the road in a ditch and have to call a tow truck. And our tow trucks are ambulances for our bodies. And so, the question is, how do we, using this technology, become just an even more preventative and proactive in how we care for our bodies and our health as we do the health of our cars?
Right. I like that analogy. That's a very good way to put it. Monica, what about you for opportunities in the future? What do you see as being something that we'll see in healthcare and AI?
Yeah, so I think we're going to continue to see, advancements around personalized medicine, as I mentioned. So we're going to continue to see improvement in that area. So for genomic insights, AI is going to help us develop like deeper insights into individual genomes and people's genetic profiles, and that will allow customized therapies for analysis of like multi-omics, so genomics, proteomics, metabolomics, which will lead to more advanced and tailored therapies for each patient, ultimately improving treatment efficacy and reducing any patient side effects. I think that we'll see, even in the clinical trial side, kind of improving the efficiency of clinical trials. So, we could have, virtual clinical trials, get a wider, I guess, cohort of individuals to participate in some of these clinical trials, ultimately, helping to improve any biases or disparities that could impact people that could participate in clinical trials. So it helps with patient recruitment. It'll help like identify suitable candidates for clinical trials, and this ensures more diverse representation in our participation pools for these clinical trials, which has been sometimes a barrier in the past. It can also help with improving, patient engagement and adherence to their medical treatment. So with using kind of personalized health apps, it'll offer kind of customized advice and reminders, as Bruce mentioned, to help kind of support the patients and helping manage their own health and their conditions more effectively. And providing kind of behavioral insights, I would say, into analyzing, patient behavior, and that can provide more insights to the physician in regard to helping them make sure that their patients are adhering to their treatment plans, which ultimately can lead to better outcomes.
Right. I think much like most things, we want everything on demand. And if we could get personalized health information and guidance on demand, I think that's going to be a game changer for people.
That's a really good point, though, Lucy, because if you think about what's really changed, the technology, as we talked about, has been around for a long time. What's driving the tipping point in healthcare is that we as consumers, whether you're the provider working or the patient or any of the stakeholders, every other area of our lives, this technology has made our lives easier and better.
Right.
And so we have an expectation that I shouldn't go to work and now not have access to the same level of simplicity that I've grown to expect in how I order a book or go down the list. We all know how our life or get a haircut or
and I think
order food.
There's an appetite for it because people younger generations are looking to things like TikTok for health information. And I think most people appreciate when they can find a community of people who share the same symptoms. And obviously that's different than personalized health guidance from a professional. But what I mean by that is just that people are looking for that on-demand information. And they're already on the internet and they're seeing it. So to have, at their fingertips, the ability to connect with a provider on those concerns or, care needs, I think that's huge.
And I'll also call out, it's not just the younger generation that's expecting this. My mother, who has a VCR that flashes 12 o'clock still, she is all over her iPad and her iPhone. She knows how to do everything on it, primarily because she uses it to FaceTime with her grandkids and to stay connected. But because of that, it's not, and she's in her 80s, it's not a very difficult ask for her to use it. She has pacemaker. She has an app that she monitors her own pacemaker, and she knows that those signals go to her cardiologist. And so, don't underestimate the fact that our seniors because the tech has become ubiquitous in their lives as well, that they expect this in how their health is managed also.
Right. That's very true. I wonder, a lot of things have shifted in a very positive way towards not just looking at individuals' physical health. We also take into consideration behavioral health, but overall we look at people's socioeconomic standing when it comes to health and how it influences that. Are these tools in AI taking that into account? Is it right now focused more on the physical sort of, makeup of a person, or is it looking at the socioeconomic factors?
Let me just make a quick comment, and then I'll defer to Monica, coming from an academic institution, to see if she knows what studies have been done. But first of all, fundamentally, I know more about what's in a can of soup that I'm about to eat than what's in the algorithm that is informing certain AI, guidance. So, and I will tell you that it's not a one size fits all, and we have to have more transparency to understand, what is informing the AI. It has to, just because something works in an urban population in Chicago, it may not work in a rural population in Maine or in Minnesota that has a more, people with more of a Nordic background. I mean, we're all different, and it's okay to recognize that our data sets may be skewed or informed based on whose data, the populations that was formed. So we may need to have, very we talk a lot about our large language models. We may have to have small language models that are, that are really targeted at specific populations. And then depending on, what fits the profile, to have, access to the right data informing it, because you're right. I mean, today there's no one size fits all. And
right.
And so we have to be mindful. One, we have to be aware of what is informing the guidance to make sure that it's appropriate for that particular individual or population that you're trying to apply it toward.
Right. Yeah. Monica, any tools you're aware of that are helping that make that possible?
Yeah, I would say that, there's always ethical considerations in any, tool that's being used. But I would say that I see that there's, bias mitigation strategies that are being used. So like hospitals, we're working on strategies to identify and mitigate any biases in the algorithms, which includes, diverse training data and doing fairness audits. So, again, these models are only as good as the data that is being produced into them. So I would say that, making sure, as Bruce mentioned, that there's, a diverse, quality cohort of individuals that is representative of the patient cohort that's going to be, treated or help with their care. It's representative, right? So we're not training the models on one population and then applying that broadly to, every population. It has to be, done intelligently, which I do think that, a lot of that is on the front of mind of anyone that's, developing these tools. And especially on the academic side, you want to make sure that your models aren't, overfit, and that you're, using them, I guess, intelligently to make sure that you're, getting appropriate, assistant outcomes. So I would say that on the academic side, it is something that is front of mind, and we do make sure that we're not, that we are intelligently using the models.
Right. In the name of transparency, is there any, disparities that exist right now that you have heard maybe AI won't be able to address, or maybe might worsen, or there are concerns there that you've heard?
Transparent communication is always a key. So, I mean, that's a part of like trust and acceptance. So I've seen, making sure that we're engaging in transparent communication with, all parties, the patients and the staff, about the capabilities and limitations of AI. I think that, helps to build trust. So just being, open and honest about, where where the upper bound and the lower bound, lower bound of kind of what these models are capable of doing. I think that that's really key to, building this trust and acceptance. And I think, training and education around, these models is also going to be really important, to make everyone kind of feel comfortable. It's crucial for acceptance. So I think that there's a layer of education probably that needs to be available, which is, part of what we're doing today with this podcast, is kind of talking about it and helping, everyone understand, what this is, and that helps to like build, trust, and allows like for everyone to feel a little bit more comfortable with this being a part of their lives.
Right.
And I definitely think that obviously there needs to be more transparency as to what's informing the algorithms. But I think the most important point to make here is AI is not taking the place of human decision making. This is a tool that the clinician that is caring for you has in his or her toolkit to help be better. And so they're trained to be able to recognize if the AI algorithm is recommending something or calling something out, and it doesn't really seem it seems to be contradictory with what that clinician knows, then it may very well be, inaccurate. And that's where we have to rely on the human that's in the loop, that's highly trained, to use their professional training and common sense to refute what that's saying, and then help to make the model better. And and that's
Right.
the feedback loop that has to happen. But I would tell you that there will be a governance for safety and quality of AI, and whether it has to come from the government top down or it becomes a self-regulated initiative, which there are a number of things underway today by health systems and different professional organizations that are trying to certify, put a good housekeeping stamp of approval on different algorithms to say that it's safe and that it works, and or which populations it's safe and works for. And so I think that's important. But the most important thing is to know that this is never to take the place of the human in the loop and the ultimate clinical decision maker being that physician or that nurse at the point of care who is getting more information, better information, hopefully, to make those decisions. But at the end of the day, it's still their decision.
Right. And I would just add on to that to say that the provider-patient relationship is still there and still needs to be there, especially in an age where we're talking a lot about, medical mistrust. I think that person-to-person connection and being given care by someone who looks like you and represents, your community, that all still counts and matters very much so in delivering care.
Absolutely. Trust is foundational to any healing.
Exactly. So to switch gears a little bit and just touch on the cybersecurity piece, obviously health systems across the country have just recently faced a huge breach. And I wondered, in the conversation around healthcare AI, how are we protecting patient data and privacy?
Yeah, well, the cybersecurity discussion is so much bigger than just AI, frankly. Our vulnerabilities. The comment that I'll make on cybersecurity is it is not a healthcare issue. That is a national security issue that the federal government needs to intervene on, because healthcare is a warm target for those bad actors. And so this is an issue that's bigger than healthcare being able to solve on its own. So I think that's the first perspective on cybersecurity. That said, there are some, as with the frenzy of AI or any other emerging tech that is in any way connected to the internet, which all of it is, whether it be your robotic surgery, your infusion pumps, your pacemakers, they all have a gateway in for bad actors to intervene. Most people think it's just the EMR, but it's really, that's just one example of a path in a way that these hackers can make money. And so I think that there is some base level expectation and responsibility for people bringing these products to market, that they're going through the appropriate safety measures and baking it into how they develop. And I think you're going to find more and more decision makers on health systems having a much higher bar for who they're going to let in to their network and their ecosystem because of these exposures, because every health system is as vulnerable as their most vulnerable partner.
Exactly. Monica, anything you would add on that end?
Yeah, I would say that, I've seen Michigan Medicine, we're working on implementation of advanced, security protocols. So I think, a lot of hospitals are adopting, even more robust cybersecurity measures to make sure that the patient data is protected. So, we have some protections like encryption, multi-factor authentication, and, regular security audits. There's also a lot of compliance for regulations. So, hospitals and other institutions are always, ensuring, they are acting compliantly with, HIPAA and safeguarding, all patient information. That's always a top priority. And I think the CIOs and CTOs, are working to re-architect some of their systems and, as Bruce mentioned, adjusting these contracts with the vendors, to make sure that, exposure is limited. I know that there's talk about, even bringing in some chief, AI officers. So adding another layer to the team to support, the CIO and the CTO, to have that governance structure and oversight. So it's definitely a strategy that is being prioritized right now and is top of mind with modifying, compliance regulations and, use of, any personal healthcare information and making sure that it's, being protected. But again, this is something that every industry I think is facing right now. As Bruce mentioned, it's not just healthcare, but, it is something that, the healthcare industry does take very seriously. And, they are, taking steps to, mitigate risk as much as possible.
Absolutely. And we just had Jack Kufal actually on the podcast last month from Michigan Medicine to talk about some of your cybersecurity work. So we didn't get into healthcare AI so much, but I would just encourage anyone who hasn't to check out that episode. It's a really insightful conversation. Monica, on the note of, learning from other industries, I want to go into that a little bit. What would you both say healthcare can learn from industries that have maybe been utilizing AI in ways that we aren't? Or maybe, the learnings and maybe some opportunities that we're not taking advantage of?
Yes, I would say that, data utilization and integration is an area that, a lot of industries, again, use like, transportation industry uses AI to integrate data from multiple sources. So like traffic sensors, GPS, weather data, they use that to optimize their routes and their schedules. And, healthcare can, apply, it in the same manner so they can learn to kind of better integrate diverse data sources such as the EHR, the wearables, the imaging to kind of help like create comprehensive patient profiles and optimize care pathways. So that's kind of a similar, model in another industry that, we're seeing healthcare really utilize some of that in their domain. And then again, like real-time monitoring, I think this is like Bruce's wheelhouse, so he can probably get into that. But, the transportation industry does, monitor individuals, real time as for your vehicle health, as he mentioned. And, healthcare can really be, used in the same way and have predictive analytics to anticipate, medical issues before they become critical. So I think that, with Bruce's background, he could probably really get into some of these examples in more depth.
Yeah, thanks, Monica. I think transportation is a good example. And actually, let's double click on that. So, and let's also talk about what is incremental improvement and what is transformational change, both in healthcare, and let's look at that in transportation first. So incremental improvement, most of us have the backup camera in our car. I think since 2012, it's required for all new cars to have a backup camera. I get into fewer fender benders in a parking lot. It's absolutely better than not having a backup camera. But the question is, how is that transforming legacy costs and inefficiencies in transportation that we've just grown to accept, like what we pay for car insurance and traffic and road construction and first responder deployments and on and on? It doesn't. So the question is, what is it that is the transformational change in healthcare? And it's really the autonomous driving car. And it doesn't necessarily mean that it doesn't have a driver, but it means that we're surrounding that driver in many cases with technology, with a neural network of advanced sensors and AI that can anticipate what's happening as you're driving and automatically brake before you rear end somebody or prevent you from drifting out of your lane or dynamically reroute you to avoid traffic so that you can get to where you're going faster. And so if you, we actually work with a company, a publicly traded company called Luminar that builds the advanced sensors and AI that power many of those autonomous driving cars. They're specifically working with Volvo, Mercedes, Nissan, Toyota, and a number of other car makers to aspirationally create what they describe as the uncrashable car. And they believe that they can save 100 million lives over the next 100 years by having that more advanced technology of ambient sensors and AI that are helping protect the drivers and the people around the drivers. And so the question that I would have in healthcare is, if that their aspiration is an uncrashable car, what is a harmless hospital? If we could be ambiently aware 24/7 of everything that's happening within our organizations and had the ability to drive immediate action in real time, sometimes where things are happening automatically that no human needs to be involved with, like leapfrog hand hygiene compliance reporting, or or to prompt that human in the loop to be able to to do things proactively and preventatively. And so I look at what we're doing today, for example, with virtual nursing. Many health systems are putting a camera in the room and they're doing admissions, discharges, and that is a great incremental improvement, like a backup camera in a car. Absolutely. The question is, are you using virtual nursing as just another point solution, like another backup camera, or is the tip of the spear for a much more transformative change where that sensor, as I mentioned earlier, is surrounded not only as a camera, but also is layered in with ambient monitoring to ambiently look and listen, to be ambiently aware, and create neural networks with all the other sensors through all the common areas, patient rooms, surgery, ED, point of entry, discharge, and learning from that to be more proactive, to anticipate what's happening, and layer in AI to drive real action in the moment. And so for me, if you look at what transportation is doing today, what is real technology that's working today, this isn't new. It's only new to healthcare. The question is, how do you apply it to healthcare? How do you recognize that, at the end of the day, this may be something that the FDA is going to want to regulate, that it needs to have cybersecurity, it needs to have regulatory compliance, it needs to have antimicrobial coating to make sure that it can be in sterile areas. And and on and on. Is it high trust certified? Is it SOC 2 certified? All those other things. So we need to think about technology that's proven to be transformational in other industries, and then not just assume you can just lift it and take it as is for healthcare. But we have to be the experts in healthcare to then say, how do we apply this in a responsible way so that it can move the needle on the things that matter most to healthcare and to our patients and to our providers.
Absolutely. And we skipped a little bit over the ethics and regulation piece, but if you don't mind elaborating a little bit on that, of what you think that will look like in healthcare, and if it's already kind of in process, that's top of mind, I would imagine, for those that are starting to utilize some of these new technologies. What does it look like maybe in virtual nursing as an example?
Well, I think you're starting to see a lot of things with best practices. And again, all best practices are still pointing to a human in the loop. So, at the end of the day, this is to empower our bedside caregivers to be at the top of their license, not to take the place of our bedside caregivers. And the reality is we don't have enough of them. So we need to figure out how we empower them to do things that are at the top of their license, and try to offload to others, or avoid having humans altogether do the things that aren't really necessary. And I think what we're finding is those best practices are very actively being shared among, because we're still early. I with all of this, and I probably should have said this at the very beginning, we are all in very early innings with where all this is ultimately going to go. So the most important things we can do foundationally today is over communicate, not overreact, but over communicate with learnings. And you're starting to see affiliations and associations of that collaboration and data sharing happening, so that best practices are being shared proactively with people who are starting on that journey, and that we refine the approaches and the technologies and the models to make sure that it gets smarter. I know that eventually I would suspect that the government will play a role in regulating a lot of these things. But we can't wait until that happens. We have to self-regulate, and we can't wait until the government weighs in on it to get started either. We have to move at the speed of tech, not at the speed of our government, or not at the traditional speed of healthcare.
Right. Do we have an idea of what the implication would be for providers if say, one of these technologies doesn't work or fails?
Well, I think, I don't know that there's legal precedent for that yet, and I could be wrong. That's not my area of expertise, but I will tell you that's why I think everyone needs to be quick to say that this is a tool in the toolkit for our providers, just like every other tool that they have. At the end of the day, they are the ones still responsible for directing how care is delivered.
Right. Absolutely. Monica, anything you would add on the ethics and regulation piece?
Yeah, I think it's just really important to have, continuous monitoring and updates. So I think I've seen, hospitals are establishing protocols for, continuous monitoring of the performance of any of these models, and, regular updates to kind of improve the accuracy and address any, identified issues, having strategies just to identify and mitigate biases, including, like I mentioned earlier, these diverse training data sets, and, having, fairness audits. So it is something that is, a part of the system to be kind of, like continuous improvement, continuous monitoring, right? So you want to make sure you're monitoring how these models are performing, and, not just, again, as Bruce mentioned, as far as your question with liability, I mean, it is ultimately a part of the, expert or professionals, purview to make sure that, what they're using, to help them, just like any other, tool that we use in healthcare, any other technology. I mean, I think that that's where we build a lot of trust, is, making sure that patients know that, we aren't blindly, using these tools. They've been properly vetted through the proper channels, and they're being monitored as well, along the way, just like physicians, they have their performance is monitored too. So, it's a part of the process, just to make sure that we're always improving, accuracy, and then also identifying any issues with any of these AI tools that are being used in healthcare.
Right. Yeah. Just to underline it one more time, the goal is not to replace clinicians. It's to assist them and help improve our processes on the operational side. I appreciate you both so much. I've learned so much from this conversation, and I know our listeners are going to take a lot away from it. The last question I have for you is just any advice you would give to people who work in hospitals or healthcare leaders specifically. What do you hope they take away from today's conversation? Bruce, we'll start with you.
I think I have two things. One is, for the first time maybe in my career in healthcare, I think it's obvious that the status quo is no longer an acceptable option. Historically, doing nothing related to a lot of these things was always okay. And the more you didn't change, the more change would go away. This is real. You need to understand it. You need to be intentional and deliberate, and have a strategic plan and move quickly. And then secondly, and maybe most importantly, and this sounds like a paradox, but I believe we have to embrace AI to restore humanity to healthcare.
Thanks, Bruce. A very strong note to end on. Monica, any parting wisdom you'd like to share?
Yeah, I agree. I echo Bruce's comments. I think, embracing AI as a strategic priority is, it should be a key takeaway for, hospital and healthcare leaders. AI should really be viewed as kind of a critical component of any kind of future-ready healthcare system. So leaders, should prioritize, any, I think, AI initiatives just to stay ahead of the technology advancements. And I think keeping the primary goal, though, of AI implementation should always be to enhance patient outcomes. So these AI solutions should always be designed with the patient at the center, and with the goal of improving diagnostics and treatment and the overall patient experience.
Absolutely. And I want to thank you both again for being here. It's really been such a wonderful conversation.
Thank you so much, Lucy.
Yeah, thank you, Lucy, for this opportunity. And thank you to the listeners for your time and interest.
Absolutely. With that, I'd like to thank our listeners for tuning in, and encourage anyone interested in learning more from our guests to check out the description of the episode or head to MHA.org. Any websites, or I know Care.ai is an endorsed business partner of ours, but anything else you would plug from that end, where can we find you guys?
For us, Care.ai.
Perfect. Monica, what about you?
I currently, my research is currently funded by a company by the name of Phenomics Health. They do a lot of genetic testing around the pharmacogenomic area. So I would say if you're interested in learning more about your genetics and personalizing your healthcare treatment plan, and helping with your medication management, I would check out Phenomics Health.
Perfect. We'll include links to both those websites in the description of the episode and in the newsroom article that we pair with it. But thank you again. We'll be back soon with another episode. Thanks for listening to the MiCare Champion Cast. To learn more or get involved, visit MHA.org.